It is.
Dispatcher Chris Solomon's day is difficult, demanding and life-saving.
You're going for a 21-year-old male that's fallen 40 foot, over. Yeah, roger, I received 40-foot fall, 21-year-old, 237816, over.
Without him, the Helimed team couldn't do their jobs. Hundreds of people owe him their lives.
But no problems, we're on his way, Chuck. Cheers, love, bye.
But this morning, the 999 screens are blank. It's Chris who needs help.
You know, well, last one, diabetes, epilepsy.
He's arrived for work with a pain in his chest. Paramedic James Vine is concerned. His symptoms are worrying enough. But the readout on the cardiac monitor is unmistakable. Chris is having a heart attack, and it's massive.
ECG looks a little bit dodgy at the moment, not 100% sure what it is. Okay, but we'll just err on the side of caution. Just going to mean a trip down to LGR. Okay, let's pop that up there for us.
Even in the 21st century, a simple aspirin is the most effective first aid for Chris. It will help thin his blood.
God, water.
They'd like him checked out at hospital, but it's so early, its helipad isn't open.
It's going to need to be the secondary site.
What time do they open?
8 o'clock. Or we're best with a crew.
I'll have a crew.
Yeah.
A blood vessel in the back of Chris's heart is blocked. James can see that much from the trace, but it's about to get a lot worse.
Down on the floor, get him on the floor.
Chris goes into cardiac arrest. His heart has stopped beating. He's no longer breathing. If James and Lee don't start CPR in minutes, he will die. The blow to Chris's chest is designed to help kickstart his heart. Lee and James know heart massage is only effective in a tiny minority of cases, but their friend and colleague's life depends on it. It's time for even the Helimed team to dial 999.
Hello, can I have an ambulance, please, at Leeds Bradford Airport? The air ambulance base, please.
Connect electrodes.
The chopper's defibrillator has been brought in. It will deliver a massive electric shock to his heart. It takes 2 jolts, but at last Chris's ailing heart spawned.
All right, Chris, go on, kid.
Chris's colleagues are fighting to save his life. He's in the best possible hands, but there's a serious problem. Unless the fire crew that man the Leeds General Infirmary helipad can be contacted, Chris's best chance of survival may be lost.
Go on, Chris.
Chris?
You with us, mate?
Chris?
Helimed team dispatcher Chris Solomons had a massive heart attack minutes after he arrived for work. After a shock from the chopper's defibrillator, his heart is beating once more, but it could stop again at any moment.
Chris, it's James, you're at work. It's just oxygen, it's just James, you're at work. Just relax.
Hey, Chris. All right, mate, you're okay.
And there's a problem. It's early morning and the helipad of the Leeds General Infirmary is still closed. Helimed 99 can't take off unless the hospital's fire crew can be raised.
We don't open till 8 o'clock in the morning. We're on the early shift today at 7. It's now 7:35, so we may just get lucky, but we'll wait and see. Got an ambulance on the way, and we'll decide then what's the best thing to do with Chris. So he's back with us now, so thank God for that.
Paramedics Lee Davison has treated hundreds of patients with heart attacks, but never a friend and colleague. He and James Vine are assessing Chris's treatment so far to make sure they're not missing anything.
Okay, should we just reanalyse everything then?
We're back in
Back in normal sinus rhythm, okay? He's got a line in. He's had no adrenaline. He's had aspirin. He has had buckle and CPR and shocks.
2 shots.
Chris is in agony. He's experiencing the symptoms that kill 120,000 people every year in the UK.
Had to shock him twice, trying to get the heart back into a normal rhythm, and we've worked on him with some CPR as well, and managed to get him get some output. And we're just trying to stabilise him now to get him down to the LGI so that we can get some of the cardiac team to look after him from there. All right, Chris. All right, mate. You're okay. You're at work.
What's hurting?
Okay.
Never got the aircraft out so fast. Hopefully we can use it. If we can't, it's going to be a real pain for us.
Cheers, thanks, bye. Crew's here.
A ground ambulance crew are about to join the fight to save him.
Oh, absolutely dreadful for us, obviously, with it being one of our own, and just took us on the hop a little bit there. Obviously, we just didn't expect him to come in like that, but that's what we're trained for, and we've managed to get him back. Hiya, mate. Hiya. Just need trolley off. Yeah. All right. We're just debating whether to go by air or not. Because cardiac arrest? He's had an arrest, yeah. Yeah. We've got output, yeah. Yeah. He's been shot twice. He's in with chest pain. Looks really pale, clammy. He went off on us after about 10 minutes. Right. And we've shocked him twice. He's had CPR. We've got him back at the moment. He's been speaking to us. Right. So we're going to go on to trolley initially. If we can get hold of the LGI, we'll just trolley him to aircraft and take him. Okay?
What we're going to do, lads, is if we could just hang on 2 minutes. We're just sorting the helipad out. Yeah, I think so. It was just with a couple of extra pairs of vans. We didn't know where we were up to at that stage.
But at last, the team has some good luck. The LGI's fire crew have been located. Chris will be able to fly straight to A&E.
Bad day at the office. Not even had a cup of coffee yet, have we? Not 3, 1, 2, 3, lift.
He's still wired up to the ECG. James isn't taking any chances.
Yeah, Chris just gave me the shot of my life, I think.
He'll be able to monitor Chris's heart in the air.
Okay, 1, 2, 3 and lift.
Keep going, lads, keep going, keep going, keep going, keep going. Beautiful.
All right, buddy. Yeah, bud.
Chris is responding well, so well that James can crack the odd joke.
Okay. Try not to do anything stupid like that in the flight on the way down for me, because me and you are barely talking as it is at the moment. All right.
But he knows his patient's not out of the woods yet. Chris is 5 minutes away from the primary angioplasty unit of the Leeds General Infirmary. It's there a team of surgeons deliver the most up-to-date treatment available to heart patients.
The plan is that Chris is going down to the LGI, down to the CCU down there, to be assessed by the cardiology team, trying to open the coronary artery that's blocked.
A tiny tube will be inserted into Chris's heart, and the blocked artery opened out. A tube, or stent, will stop a clot reoccurring.
3, 1, 2, 3 and lift.
Many of the hospital's fire crew ran to work this morning. They knew the patient was one of their own.
All right, mate, we're just coming into coronary care, okay?
Chris has played an important part in saving the lives of hundreds of heart attack victims by ensuring the staff of this unit have a full breakdown of a patient's medical history. There's no one to do that for him today, but James and Lee will do their best.
2 shocks, 200 and 300 back into a sinus rhythm. Systolic's been initially hypotensive at 70, 500 fluid challenge, just brought him up to a systolic at 118.
All right,
pain score is still about...
James and Lee have kept Chris alive long enough to give him the best chance of a good recovery.
We've come into coronary care at the LGI. Obviously this is what they specialise in here, so he's in the best place that he can be. We're just getting him transferred over to the team here, and then obviously we'll leave him from here, but going on from here they'll probably take him to the cath lab and just have a look with the x-ray and see where the blockage is, and they'll determine where they go from there.
Within an hour of his attack, he'll have had angioplasty. But they know he's not out of danger yet, and it's time for them to leave.
Now remember Helimed dispatcher Chris Solomons, whose sudden heart attack led to the sort of medical rescue mission he normally organises himself. Let's catch up on his case.
Chris is lucky to be alive after a cardiac arrest. It would have killed him if he hadn't been in the office with paramedics James Vine and Lee Davison. They were able to save his life by shocking his heart back into rhythm.
It's our bread and butter, we deal with that every day of the week, but it's very, very different when you're having to do it for someone you genuinely care about. You know, he's a good lad, he's one of our own, so you don't want to see harm come to anyone.
Now Chris is recovering in hospital after a procedure to open out a blocked artery in his heart.
I was scared. I'll tell you, I was scared. Because at one stage, my hands they were just like that. And I just couldn't open them or move them. And the pins and needles was horrendous. I then realised that there was something going on. Because I knew this wasn't any type of indigestion. Because it was going down my legs as well, pins and needles down my legs. And it's not a thing I would like to experience again. I wouldn't like anybody to experience it again.
Little more than 24 hours after the attack, Chris is sitting up in bed, enjoying goodwill messages from his colleagues.
All the guys at work have turned around and said if there's anything they can do to let them know, which is brilliant, So, just wait and see how I get on. But I'm missing it already.
Chris began to feel the symptoms as soon as he arrived for work that day.
Get him off the floor.
He was effectively dead for 5 minutes, but his memories of that morning are hazy.
I don't know if I was getting up or if they were picking me up, and then I don't remember anything after that until I'm on the floor by the table. There's Lee and James looking over me. I don't know where Cobby was at the time. Then 2 other paramedics.
Less than a week after his attack, Chris is well enough to return to work, just for a social visit.
Hi, mate.
Matey, all right? Hey?
Just be careful.
All right. No,
I'm fine.
He's here to thank the 2 men who saved his life.
Still a bit sore.
Is it? Can't understand why.
If laughter's the best medicine, he's come to the right place for treatment.
We just got rid of it short, man.
Oh, Gibble, don't make me laugh, it hurts.
It'll be a month or 2 before Chris is even ready to think about returning to the dispatch desk. But at least he now knows how many of the team's patients feel.
Knowing that it was James's official last day, I wanted to come up and see him before he went back out on the road just to say thank you. I mean, I didn't know Lee was going to be here, he kept that a secret from me. But no, I just basically wanted to see James before he went off duty because I knew I'd see Lee another day. But to see them both in the same day is great, and just to say my thank you to them.
It's a long road to recovery, but Chris is determined to get back to work with the HeliMed team.
I would much rather be back at work doing my job than be sat at home not doing anything.